Hey, this is Eric for Kinesiology 353. This is the first assignment, ankle taping. My wife here is helping me out, and we're going to demonstrate some ankle taping, and we're going to pretend that she has a grade 2 ligament sprain. With a grade 2 ligament sprain, you're going to have a lot of pain in the lateral side for this example. Weight bearing is going to be extremely painful. It's going to be tender, there's going to be swelling. With a grade 2, you have partial tearing to the ligaments. One or numerous ligaments in the ankle. Before we get started with the taping, just some quick notes for an ankle sprain. You often hear the RICE method: rest, ice, compress, and elevate. Probably for the first 72 hours, just to be safe. I would not start exercising before 48 for sure, but 72 is kind of a good window. Another thing that you could do is X-rays. X-rays could be taken. You can really get to know what's going on in your ankle with an X-ray. And I'd also recommend with a grade 2 ankle sprain that you could use crutches for 5 to 10 days, and then kind of just go from there and see if it's feeling better. You can stop sooner, and then also wear an ankle brace for about 2 weeks. So for the ankle taping, I did see the video on the prompt, but there's also a lot of examples in the book. And with this specific sprain, I'm actually going to use the closed basket weave ankle taping method found in the textbook. Pretty similar to the one that you saw in the video, but it's just a little different. Pre-wrap, this is amazing for any tape job. It makes sure that the adhesive doesn't stick too much to the foot or the leg, and it makes for getting it off a lot easier. It's a lot more comfortable when it's on. So you just do a quick layer of this. Try to keep your foot like towards the ceiling the whole time. Okay, so for this closed basket weave ankle taping, it's a little bit different, but I'll go step by step here. So for the first tape here, you want the anchors, kind of like in the other video, you had the one up top here. And then the one down on the bottom of the foot here as anchors for the rest of the tape. Kind of a starting and a stopping point, if you will. And then the third piece is what was called a stirrup in that video. We'll go up here, start on that top tape here, under the heel. And then a fourth one starting from the bottom anchor around that heel. And then we're going to add 2 more stirrups and then 2 more of those heel wraps. And I'll start out with the stirrup. You're going to alternate. And then, next step, I'm going to take one, start here on the top of the foot, go around here, around the heel, and I guess that guy in that video would call this a heel lock. Up and under the heel, and up this way here, and stop here. And then for the rest of the closed basket weave, we've got 6, give or take, depending on how high you went up with the pre-wrap. 6 going around from front, back to the front. And then the last step, there's just 2 more pieces of tape here that go over the top of the foot, that go underneath here. And if I could get this. And there is my first ever closed basket weave ankle taping. Not sure how sturdy it is, but that's the idea. And right there, my patient said it feels secure. So there you go. Some isometric strengthening exercises that you could do, that you should be doing every day once you've gotten past that 72-hour rest period. Some good ones that you could be doing would be manually resisted strengthening. So if I push here on the top of her foot here, I would tell her to then push like a gas pedal on my foot. And you can do that for about 15 seconds and probably do about 3 sets of that every day. And then also after this one here, I'd go here and tell her to pull up as well. So you do 3 sets of both of those for 15 seconds a day, or as pain allows, really. Another one could be with ankle weights. You do the same thing with ankle weights, or just have the person put their foot down a little bit more. You put the ankle weight around this part of their foot here, and you pretty much just have them do dorsiflexion and plantar flexion, and just that added weight will strengthen the ankle as well. Another important aspect of the recovery for an ankle sprain would be focusing on the range of motion. Range of motion should be worked on every day, and it's kind of tapped into with the other exercises I explained. But with range of motion, focusing on dorsi and plantar flexion every day, about 3 sets of 10, is really, really important. And you're kind of already doing that motion in a lot of those exercises. But if you're just to sit there and just move your ankle up and down, 3 sets of 10, as far as it can go, enough to where you feel that pain about to set in. You don't want to be working it to where it's just killing you. It's just until you can feel that pain, and then go the other direction. 3 sets of 10 is really going to make sure that range of motion stays intact and ensure that there's good circulation in the entire ankle. You can do ankle turns, same thing, 10 for each ankle in each direction. So you just really rotate it in a circle, really. And then once you do 10, you'd stop and you'd reverse and go the other direction. Another one could be using a towel. So if you take this towel here, you can wrap it around your ankle here, and then you can pull on it, and that really just gets a stretch. It's pretty much all it is pretty much just stretching the soleus and the gastrocnemius and all of the tendons and everything that needs to be stretched, and this will help with the strengthening exercises and everything like that as well. You could also do a standing dorsiflexor stretch, which actually, it's actually a stretch for something else, really, but it does help with this injury as well. So if you stand on the table, stand over here by the table, and then lift this leg up, and then hold it like this. So when you do this, you're automatically thinking that you're stretching this, which is true, but you're also, if you look at this, you're plantar flexing so much that you're going to be stretching the anterior tibialis and all this stuff here, and keeping the ankle really loose, and that's going to improve range of motion too. So you kind of get a 2-for-1 deal with that stretch as well. All right, so some things that I wanted to touch on that I didn't really fully go over or go over at all in the earlier videos. regarding the grade 2 ligament sprain, the plantar flexion and the dorsiflexion exercises should begin anywhere from around 48 to 72 hours after the injury. It's important to do it soon, but not obviously too soon. So you need to kind of, I guess, everyone knows their injury. You know exactly, how bad it hurts when you exercise. So if you feel 72 hours, that's great. But you need to start moving that ankle, getting the blood flow, getting the circulation, getting that range of motion, the proprioception. All those factors are really important. If you jump on it sooner, the better. That's you're gonna heal better. You're gonna have faster healing time. Uh, the exercises, they should include the proprioceptive neuromuscular facilitation exercises. Um, that's where the patient will be doing the isometrics, which is what you saw in the video, as a couple of those exercises um, on the immobilized ankle, but also doing it on the good ankle. You want to work them both out. Even if the other one's not injured, it's just good to keep both ankles good with range of motion. Just do them both. Just get in the habit of really keeping them both healthy. And that'll, again, just prevent more injuries down the road for either of the ankles. Um, grade 2 ligament sprains are pretty serious. Of course, there's grade 3, but grade 2 are pretty serious. And even those can lead to a long-term instability and higher chance of reoccurrence of that injury. So the stability exercises and the strengthening exercises that we go over in class, and there's so many, extremely important, and they should be done regularly, even when you've been done and you've healed and your ankle's good to go. You should still continue to do them, and that's just going to decrease the likelihood of reoccurrence. Another exercise for the isometric section of the assignment that I didn't go over would be weight bearing, and that one would progress differently. So, say if you start out with crutches and it's just really tender and sore and swollen, you don't want to step on it. So you would gradually put weight down, and as the week progresses, as the 2 weeks or 3 weeks progresses, you would put more and more and more weight on, um, just to get that load bearing, just to get that ankle used to that weight again. That's really important, and you would try to do that every day, as much as your ankle would allow it. Not too much. You don't want to go overboard and re-injure it or anything like that. But definitely try to do that every day. For progressive resistance exercises, like I said, the weight bearing from the crutches to a full body weight over the course of 2 weeks. The small amount of pain is tolerable. Um, and that's as pretty much as far as you should go. You should never push it to where it hurts too much. Balance activities, that's something I didn't really go over with my wife as the example. I don't have any BAPS boards or BOSU balance trainers or any of those things that are described in the text. But what you could do is you pretty much start out with 2 feet on the ground, close your eyes, stand there for 30 seconds, and you'd slowly work your way to going onto the 1 foot, the injured foot, and closing your eyes and sitting there. And you'd really have to work on your balance because your ankle's weak at that point. And so you'd think like, oh, sitting on 1 foot is very easy, but the pain and all of that and just the weakness, it's a lot harder than you'd think. And then of course you progress. And if you had those training tools such as the BAPS board or the BOSU balance trainer or any other kind of boards to train on, you'd use those to further strengthen your balance. And you'd try to do those, I'd say 3 sets of maybe 30 seconds every day or every other day, just enough to get your ankle moving and get a little bit of exercise. And then, of course, when you're not doing these exercises and say that pain kicks up, go right back to that RICE method. Rest, ice, compress, and elevate. And that ankle should heal. And thanks for watching.